Okay, on today's health check, we're going to talk about something that affects 20 to 30% of the population, and it is irritable bowel syndrome. I'm here today with Dr. Ed Polashenski. We're at the offices of him and Dr. Yamula as well on 14th Street. You're part of the Health and Wellness Center as well, the Hazelton Alliance. Thank you so much for speaking with us today. First of all, would you like to explain to everyone what irritable bowel syndrome is, being it's the time of the year for it?
Irritable bowel syndrome is a very common problem that we see in gastroenterology, affecting 10 to 20% of the population, more so in women. Symptoms are bloating, cramps, and either diarrhea or constipation. Very disturbing at times and can be disabling to the point where people miss a lot of work because of it, and something we can treat.
Okay, so how easy is it to diagnose this? You just mentioned some symptoms, but
Yes.
Can it also be masked by other things?
Well, the symptoms are very common. Diarrhea, constipation, and bloating can be seen with a lot of diseases. And so the diagnosis of irritable bowel is by exclusion. We make sure that you don't have something more serious, like Crohn's disease or celiac disease where you're allergic to gluten. And so we would first go through a series of steps to confirm that there's not a more serious problem, and then proceed with treating irritable bowel.
And the treatments for irritable bowel would be what?
Well, depending whether you have the diarrhea with it or the constipation, you would treat it differently. With the diarrhea, there is a strong evidence that treatment to stop spasm and the diarrhea itself is very effective, so we would use drugs like Imodium. Peppermint oil is very good for it. If that doesn't work, there's medical treatments, a drug called Amitiza. On the opposite side of its constipation, we find that antibiotics are very effective for treating it. Drugs like rifaximin 3 times a day would be beneficial. Increasing the fiber in your diet, using drugs like Miralax for constipation. So there's very good effective treatment for it, and you just need to see your physician, get it worked up, and start treatment.
Okay, so if anyone out there feels that you may have some of these symptoms, see your doctor. You can be referred to Dr. Polashenski, or any of the other fine doctors in the area. And then because if left untreated, you could be uncomfortable, it could cause other problems. And just give them a call. It's something that's pretty simple. It's pretty easy to diagnose and treat. And that's this week's health check. I'm Deb Lissette from Dr. Polashenski's office, and we'll see you next time.